This strikes me as a really good idea, this idea of asking doctors and nurses to work overtime in the NHS to clear the backlog. Is this something that has been tried before? And if not, why not?
Well, I don't know whether it's been tried before in a specific way. I do know that at the end of the day, when you've got a problem as serious as the backlog that we've got now, you have to do something a bit out of the ordinary to get through over the coming year or so. And what Labour seem to have done, and I should emphasise I'm not a Labour Party member, what Labour have done is spotted something which the government seems to not have spotted, which is that, give or take, on Saturdays and Sundays, only about under a quarter of the operations that are done Monday to Friday are done in our acute hospitals. Now, that's clearly spare capacity. And then comes down to, can you persuade the staff to do it, and can you pay them to do it? And if I was a minister now, I wouldn't give the NHS any more money until they started to do some specific things that were in the best interest of patients. And it's clearly in the best interest of patients to actually use those Saturdays and Sundays spare capacity to get the backlog down.
Lord Warner, you are absolutely correct, but surely this is already government policy with Jeremy Hunt. Remember him, he's now the Chancellor of the Exchequer. When he was Health Minister, introduced a 24-hour a day, 7 days a week NHS plan. But you correctly say that that's not something that's taken off. There's a significant underuse of capacity on Saturdays and Sundays. Where do you think there's institutional resistance to people working at the weekend in these hospitals and acute health care settings, or do you think it's just to do with cash?
Well, you've got a government that's actually seriously fallen out with the NHS labour force. So the chances are that whether you moan about the Labour's connections to the unions or not, the chances are a new government is certainly can't have such a bad relationship with staff as this government has managed to do. And it all turns on, can you persuade the staff to turn up on Saturdays and Sundays into these empty operating theatres and do these jobs?
Well, Lord Warner, just to ask you that question again, if I may, because I think it's really important we try and get to the bottom of this. This has been government policy for about 5 years already. So Labour relations may be at sort of rock bottom, but they haven't been for the entirety of that 5-year process. Is there an institutional resistance in the acute, basically hospitals, acute settings, the NHS, to people working at the weekend? Or do we need to renegotiate the contracts? I mean, genuinely, how do we try and crack this nut that has eluded us for the last 5 years?
Well, there certainly is institutional resistance at this point in time. And clearly this government has failed to get this spare capacity used. I still come back to the point I was making. If you want the NHS to do something specific, you give them money for some very specific purpose, and you measure that they have done that in the way that you wanted them to do it, which is to do those operations on Saturdays and Sundays. Now, that's the only way you're going to overcome institutional resistance. If you keep giving the NHS money unspecifically, you will get what you're getting now.
OK, so we need targeted cash. I don't know, maybe paying people time and a half, double bubble or whatever it may be, to work at the weekends. And the Labour Party has said that they're going to raise this money from closing the non-dom loophole. Just for our viewers at home, it's the ability of people to live in this country but effectively not pay UK tax because they are domiciled elsewhere, whether that be anywhere else around the world. Do you think that policy will raise enough cash to target this money into creating a true 7-day-a-week NHS?
Well, without seeing the books, I have no means of saying whether it will or it won't. What I would say is that this is actually a limited times kind of project. It's not going to go on forever and ever. You're not going to get people forever and ever working enormous numbers of hours of overtime. So even if there is not enough money in the non-DOM's budget, you could actually borrow, and I wouldn't be afraid to borrow on a very short-term basis to get this backlog down. and get some of these patients who have been waiting such a long time, their operations. I think we've got to actually be willing to take a few financial risks to actually deal with this problem as serious as it is. And don't forget, on top of this problem, we've got 3,000 people are being admitted each week because of obesity to the NHS beds.
Well, we've been talking about that here today. I mean, it's an absolutely extraordinary number of people. It's the front page of today's Times. I don't know if you spend much time election leafleting anymore. I'm sure you do occasionally. A absolutely classic Labour Party leaflet is the Tories' secret plan to privatise the NHS. But the Shadow Health Minister, Wes Streeting, has been taking on people in his own party saying there should be more private provision in the NHS. Sorry, it hasn't been taken on. But in your time as Health Minister, do you think there is a bigger role for the private sector to play in clearing this backlog?
Absolutely. If you want to give patients more choice, you've got to give them more choice. You've got to have more capacity. And one of the things I did without civilization ending was negotiate with the private sector to build some new elective surgery hubs in which they would do deal with NHS patients, and they would do those operations for hips, knees, whatever, and they would do them at the same price that it cost the NHS. And they were willing, providing their only condition for that was that we would keep the contracts in place for 7 years so that they could pay back the interest on the money that they borrowed. I am not the man to ask whether the Labour Party should have a better relationship with the private sector, because that's exactly what I did. And it was only killed off when Gordon Brown came into office.
Lord Warner, thank you so much for joining us today. And I think actually my father was a beneficiary of one of those private hubs that did his hip operation. So on behalf of my dad, thank you very much.